Now we shall discuss how to explain vertebral column in exam. There are 33 vertebrae are there, as we already know. General in vertebral column, the whole vertebral column, there are 33 vertebrae are there. Among these 33, there will be 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae are there. So total 33 vertebrae. Among these, there are 2 types of vertebrae. There will be atypical and typical. Typical means which have general features parts of vertebra, and atypical means there is nothing or absence or modified part of the vertebrae which generally should have. Now we'll see the characteristics of vertebrae. To tell there is a vertebral parts, this vertebrae should have body, it should have vertebral foramen, then it should have arch which will be composed of a pedicle and B lamina, and there will be 7 processes are there. Among them, superior articular process, spinous process 1, and articular processes. Articular processes are superiorly 2 and inferiorly 2. Total 4 articular processes are there. And then there will be transverse process. These transverse processes are 2 in number. Total 7 processes are there. Now we shall discuss about vertebral foramen. Vertebral foramen. We will discuss about body. Body is cylindrical in shape, and that body will be variable according to the location of the vertebrae. There will be 6 surfaces of the body: upper, which is also known as superior; lower, which is also known as inferior. There will be anterior surface. Let us see this upper and lower. This upper and lower both are rough and provides joint for intervertebral disc. The anterior surface will be convex side to side and concave above downwards. Concave above downwards. Then there will be posterior surface, which is flat above and downwards, and also lateral surface, which is flat above and downwards. See about arch of the vertebral foramen. Now we'll say about vertebral foramen. Vertebral foramen is large foramen behind body. It's a large foramen behind body and give space for spinal cord. Give space for spinal cord. Let us see about arch. Arch will be, first one is about pedicle. Pedicle is short, thick process of body. Short, thick process of body from posterior of body, from posterolateral aspect. This pedicle has 2 surfaces. One is medial, which is also known as inner, and lateral, which is also known as outer surface. Inner surface is smooth and outer surface is rough. And this pedicle has 2 borders, superior border and inferior border. Superior border will form superior vertebral notch and inferior border will form inferior vertebral notch. This inferior vertebral notch of superior vertebrae and superior vertebral notch of inferior vertebrae together will form foramen, which is called as intervertebral foramen, through which spinal nerve passes. Now let us see about lamina. Lamina is a broad plate of bone. It is a broad plate of bone behind and medial to pedicle. Medial to pedicle. These two lamina binds. Okay, these two laminae binds at medial plane, form posterior boundary of vertebral foramen. Posterior boundary of vertebral foramen. Now let us discuss about processes. Among that first one is spinous process. Spinous process backwards and downwards project from junction of two laminae. Isn't it? It's a project from the junction of two laminae meets, right? Next we'll see articular processes. Among these articular process, first one is superior articular process, which we represent as SAP. This is upwards and from junction of laminae and pedicle. Okay, laminae and pedicle. This articulates with the inferior articular process above. This articulates with inferior articular process, which I am representing as IAP. Okay, next is about inferior articular process downwards from the junction of laminae and pedicle. This articulates with superior articular process below. Right? Now we'll see the third one is about transverse process. This transverse process projects laterally from junction of pedicle and lamina. Okay, from junction of pedicle and lamina. After these, curvature of vertebral column. There are two type of curvatures. One is primary curvatures, which present by birth. Secondary curvatures, which develops after birth. Okay, primary curvatures develop intrauterine life. They are concave ventrally. You know that they are concave ventrally. There are two type of curvatures here: thoracic curvature and sacral curvature. Thoracic sacral curvatures. Secondary curvature develops after birth. They develop due to posture. There are two types: cervical curvatures and lumbar curvatures. Cervical curvature develops in 6 to 9 months. On that, baby starts sitting. Lumbar curvature develops 12 to 18 months on which babies start walking. Right? Now, let us discuss about movement of vertebral column. All type of vertebral movements can be possible, like flexion of the vertebral column, bending forwards, extending, bending straight, lateral flexion, bending sidewards, and rotation, bending in twisting form. Circumduction, it is just like a movement of a complete rotation of the vertebral column. Now let us discuss about applied anatomy. First one we'll see about fracture of spine. This fracture of spine commonly occurs at T12, L1 and L2. It is due to high loading on feet or buttocks. Okay, due to high loading on feet or buttocks. The next applied anatomy what we will see is about the next anatomy is disc prolapse. Disc prolapse, generally, commonly, this is very commonly occurs at L4, L5 or L5, S1. So I have written L5, S1, S5, S1 alla, L5, S1. Okay, next we'll see about lumbar puncture for the spinal anesthesia or CSF drainage, which will done at between L4, L3, L4 or L4, L5. Next is about kyphosis. You heard about this word kyphosis, which is also known as hunchback at thoracic curvature. It develops at thoracic curvature. The next is scoliosis. Scoliosis, which is abnormal lateral curvature. Next one is lordosis, which is also known as a hollow back, which develops at lumbar curvature. Okay, these are about the vertebral column.